Hello, my name is Nicole Nash. This is my skills video for catheter insertion. Today is October 24th, 2025. This is for fall of 2025 transitions course. My professor is Dr. Carissa White. Now, before I begin with this task, the first thing that I would need to do is check the patient's chart to make sure that she has no allergies to any of the materials that will be used in the catheter kit. Also, I need to check to make sure that she has an order for the catheter. So once I've done that, I will introduce myself to the patient, explain what we will be doing, and get her consent. Then after I explain everything, I will close the curtain, provide privacy to the patient, and then I'll begin to wash her perineal area with soap and water, pat her dry, and then get her in positioning to begin with the Foley insertion. So that's where we are now. So we'll begin. Hello, Mrs. Smith. My name is Nicole. I'm a nurse, your nurse today. So we will be doing a Foley insertion today. Earlier when we did the bladder scan, you did have some urinary retention, so your doctor did place an order for you to have a catheter placed in. And what a catheter is just a small tube that goes in through your urethra, and it sits in your bladder and it collects the urine into a drainage bag. So that is that. It might be a little bit of discomfort, but it shouldn't be painful. Does that sound okay? Can we go ahead and proceed with doing that? Are you agreeable? Yes? Okay. Let's begin. I'm gonna perform hand hygiene, provide privacy, close the curtain. I also like to put on gloves. Catheter kit here. Have a drape. Another drape. Okay, so now that I have my sterile gloves on, I'm going to get everything set up. I have my saline here, so I'm just going to attach that to the catheter so it's good to go, and insert the catheter into the lubricant. All right, so now I have my sanitizing wipes, the iodine wipes. I'm going to go ahead and take my wipe, place my hand here, and wipe from to bottom. Toss that swab. Get another swab on her right hand side, top to bottom. Toss that. Last swab right down the middle. Toss that. And now I can get my Foley. Miss Smith, please take a deep breath. Go ahead and insert. Until I see a flash. Which I do see the flash. So I'm going to go ahead and inflate the balloon. Want to give this a tug. The Foley is sturdy. I'm going to go ahead and hang the bag below the waist, which is on the side of the bed. Now, I would also put a stat lock on to attach the Foley to the thigh so that the patient doesn't, it can kind of stay closer to her body. After this, I will perform perineal care again. Then I will clean this area up. Per the facility, this particular facility, all of this can go into the normal trash. So I will clean all of this area up, make sure that the patient safety measures are all in place, bed is in the lowest position, and then call bell is in reach. Call bell is in reach, bed is in the lowest position, and I will remove the trash, make sure the patient has no discomfort, and that's it. Thank you.